Hi, everybody. This is Dr. Brett Talley Daniel, MD, and I'm a neurologist and headache doctor. And today I'm podcasting on what are migraine aggravating factors, triggers. Well, many conditions are listed as causing a migraine attack, but this is not exactly true. Why? Because migraine is an inherited genetic familial condition, and the causation of migraine is that one is born with it. Also, many of the triggers discussed casually or listed on the internet are not recognized by migraine experts. Who would a good expert or reference be for this type of information? Well, try the International Classification of Headache Disorders 3, ICDH-3, the so-called Bible for headache. They should know. What are migraine aggravating factors triggers? Well, they are scientifically researched conditions that predispose to developing a migraine attack. These terms require definition. The ICD-10 differentiates between a migraine trigger, which is something that causes an attack within 24 hours, like red wine, inducing migraine minutes after it's consumed, and an aggravating factor like stress, which builds up over weeks to produce migraine. What are precipitating aggravating factors of migraine? These factors from epidemiologic studies include the following: psychological factors such as stress, mental strain, fatigue, sleep too much or too little, endogenous factors like a menstrual cycle, environmental factors like weather change, temperature change, frequent travels, odors, dietary factors like hunger and alcohol. For other food groups, since response differs individually, there's no need to restrict intake. All right, related questions. How should individual migraine patients deal with precipitating or aggravating factors in their daily lives? With time and experience, migraine patients need to learn that an attack occurs easily under specific conditions. Therefore, migraine attacks may be prevented by avoiding the precipitating or aggravating factors that set off their migraines. It's important that individual patients know what factors precipitate or aggravate their own migraine, and everybody's different. What do the authors of the ICD-10 find by searching the literature to identifying the precipitating or aggravating factors that affect migraine? Approximately 75% of migraine patients have some kind of precipitating factors. The common migraine precipitating aggravating factors identified in various epidemiologic studies include, I'm going to go over this again: stress, mental strain, fatigue, sleep, menstrual cycle, weather change, temperature change, frequent travels, odors, hunger, alcohol. Does stress have a significant place as a factor for headache? Apart from alcohol, the other factors listed above are also precipitating factors of tension-type headache, but stress is one of the most prominent precipitating factors of migraine. Stress triggers migraine in approximately 60% of the patients, and 25% of these patients feel that the headache occurs when they're relieved from stress, and that's called a let-down headache. How strong are sleep issues? Lack of sleep is perceived as the trigger in approximately 30% of the migraine patients. Too much sleep is implicated in 25% of patients. What about weather issues? Weather is cited as a precipitating factor in 53% of the migraine patients. 11% of the patients felt that weather is the precipitant in 2/3 of the headache attacks. So it's a very frequent thing. What about red wine? Among alcoholic beverages, red wine is a famous precipitating or aggravating factor. Histamine that is related to pain, and alcohol and polyphenol that possess vasodilating effect are probably involved in the precipitating aggravating effect of red wine. In a study of a group of migraine patients who believed that red wine provoked migraine, a group who did not, migraine was triggered by red wine only in the group that believed that red wine provoked their migraine. What about food aggravating migraine? Findings regarding food suggest that the precipitating factors may differ depending on individual patients with migraine. Even from the old days, foods containing amines represented by tyramine, such as cheese, chocolate, citrus fruits, and nuts, are well known to precipitate migraine. In the survey conducted in England, 16 to 18% of respondents cited chocolate or cheese as a precipitating factor. A double-blind, placebo-controlled study in 20 patients who believed that chocolate provoked migraine found that chocolate ingestion triggered migraine attacks in many patients. On the other hand, a double-blind study using chocolate and placebo in patients with chronic headaches, including migraine and tension-type headache patients, found no difference in the rate of migraine propagation between chocolate and control, even in patients who believed that chocolate was a precipitating factor. While a large number of foods have been implicated as precipitating or aggravating factors, they do not apply to all patients. Even in the same patient, a given food does not always provoke headache. Few patients mention specific foods apart from alcohol. Therefore, unnecessary dietary restriction may have the opposite effect of lowering the patient's quality of life. The American Headache Society publishes views on triggers of migraine on its website. According to the survey conducted by Takashima, persons with migraine consume more fatty or oily foods, coffee, and tea than persons without headache. From this data, regular consumption of a well-balanced diet is recommended for migraine patients. What about migraine and obesity? Although there is no correlation between obesity and the prevalence of migraine, a study has shown that obesity is associated with a chronic progression of migraine. Despite recent advances in the treatment of migraine, many patients still do not achieve symptomatic relief. However, even in such patients, lifestyle improvement, for example, through sleep and dietary guidance and stress management, may mitigate symptoms, and maintenance of appropriate weight may represent chronification of migraine. Chabray et al. Wrote in 1999 the Journal of Headache on precipitating factors of headache, a prospective study in a national control-matched survey in migraineurs and non-migraineurs. They screened prospective factors in a migraine and non-migraine group of patients who kept a diary for a 3-month period. The most frequent precipitating factors in most groups were fatigue and/or sleep, stress, food and/or drinks, menstruation, heat or cold weather, and infections in both groups. Kelman, writing in Cephalalgia in 2007 on the triggers or precipitants of the acute migraine attack, listed stress at a frequency of 79% and food at 26%. And they listed there a group, which you can see if you go to my webpage, drmigraine.com. Another observation here is that many patients will focus on different foods that may aggravate migraine and not recognize stress in their lives, which is the most common aggravating feature of migraine. I guess one's diet is an easy thing to consider and look up and avoid, and everybody needs to watch what they eat, but food as a trigger of migraine is not the big issue here. The big issue is stress. Stress concerns personal insight, work or family relationships, time, travel, eating, exercise, faith, getting along. It's a tough series of issues that need to be worked out, sometimes requiring counseling with migraine patients. So I'm at the end of my notes on talking about this issue. God bless all you persons who have migraine. Please click on trigger down there so we can follow each other. Stay with me on YouTube for lots of other interesting, I hope, podcasts on migraine, and I will see you on the next talk.